Go ahead, Chris.
All right, it is April 30th, 2020. We are continuing our meeting from the 28th of April, and we will begin with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you for being here, for joining us remotely. We have two commissioners that are on speaker with us today. So we had hoped that we would have gotten an update from the governor on Tuesday or Wednesday afternoon. However, we have not. He's going to be speaking again this afternoon, so perhaps we'll have more guidance. However, going forward, Administrator Kelly has come up with some guidance for us. Eventually, we'll move into doing more of a soft opening of our government center, and we'll have some other requirements and that kind of thing in place for our employees, and also ask the public to probably use some precautionary methods, if we'll go with masks and that kind of thing when they come up to our service counters. But Administrator Kelly, if you want to just share some of the highlights for our public, and our staff will be getting all the more specifics. And certainly we're going to have some links on our website for the public for how to handle things like permit to carry, that sort of thing.
Yes, thank you, Madam Chair. As you know, the governor on the 23rd of April had a press conference and started talking about the phased approach to reopening businesses in Minnesota. And to that end, I kind of built a phased approach for Wright County as we move forward here, sort of in that same line and building off the guidance that was provided by the governor and others around that Executive Order 2040. So what I'm proposing is the strategies that would follow along the lines of, first off, our public counters at our facilities would still remain closed to walk-in traffic. We do service by appointment for services that we can't complete via other methods or are very difficult to complete online due to we don't maybe have an electronic solution, or it's complex to do, or we don't have a barrier or another mitigation factor put in place at this time. We'll continue to do electronic processing of documents and applications and delivering services via the virtual methods, and continue to increase to do that where we're able to build new methodologies out for that. We're trying to continue to refine those, and the state has been working with us on lifting some of the restrictions that are there statutorily and allowed us to do business in new ways, which has been helpful. Other things we've done internally in preparation for the future of a full opening, we're setting up our conference rooms and other meetings to allow social distancing and promote that happening. We're building various physical barriers at our counters, and we've built different structures in some of our lobbies in order to allow the public to do transactions with our staff, but still providing a barrier to keep both public and employees safe. We're going to continue internally here, encouraging employees that are able to conduct work remotely to continue to maximize that while still meeting the critical needs that we have. So those are kind of a very high level of the 5 things that I think we base our strategy on. I've put together a list of kind of ways that the public can still do services with the county. As you know, we've had a few things that we're going to be opening in the next week. We've had an announcement on our website now about the compost facility. The parks have set out a plan as well to allow openings next week as well. So we'll put more information out on the website related to that so folks can have the most up-to-date information that way. Certainly as things move forward, I'd like us to keep flexible and stay aware of the guidance that comes out from the many sources, certainly from Department of Health, CDC, as well as the governor, and what they decide to do as far as a stay-at-home order. As you know, this is a fluid situation. We're continuing to monitor it and move forward in our operations with that. Internally, we've had a number of discussions starting to plan for when we do have a opening of public counters and some of the methodologies that will be added to what we're already working on as far as barriers. But discussions have been had about providing potentially some face coverings or something similar, and the feasibility of that for both employees and potentially public. So I've had some individual discussions with some of my staff, and I know a few of the commissioners individually on this topic as well. So for now, I would recommend this phase one as I have generally outlined it to you, board, and I would recommend we adopt that and move forward starting on May 4th.
And we, since we don't have a time frame, but we can look at this as our foreseeable future essentially. I mean, for at least 2 weeks going forward. Is that your recommendation, Administrator Kelly?
Yeah, I was thinking a minimum of until the 18th of May, which would be a 2-week period. I think that might be a good test run, so to speak. Certainly things continue to evolve, and that'll give us time to continue working on our additional strategies we're working on. Also, in a perfect world, we'd be like operation back to the way things were. I'll put that in quotes. Maybe I'll call it a new normal as soon as we can, but certainly we'll want to do our part to protect employees and the public that use our services. So,
Yeah, definitely, and that's, I think taking this in steps, is a good way to approach this going forward, and I appreciate the extra 2 weeks because we need to get our, as you said, our public service counters, whatever we need to do to protect our staff and employees, or excuse me, public. Commissioner Betch?
Yep, so Madam Chair, so I guess I'm in agreement that, having some sort of a tiered way to it, I guess the date is kind of just.
Right, it gives us 2 more weeks for now.
Gives us 2 more weeks, and I guess we'll just that'll be a fluid, I guess it's not a hard set date one way or the other. But I guess for practical purposes to give people some level of expectation.
Right.
Madam Chair.
Yes, Commissioner Burrell.
Madam Chair, I guess I would like the board also to give administration some directions to, because I do like what's done so far here, but I would like to give them some directions as far as possibly looking into face masks. I did check with our county attorney, Brian Osleson, and he said if we were to require the public to wear a face mask or whatever, it would be advisable that we would be able to just give them some inexpensive masks to wear while they're in our facilities. But I guess at this point, I don't think we know enough to order anything, but maybe if we got administration to just, like instead of ordering something real big quantity right now, to just do some samples, order 50 of this or 50 of that to see what the quality is going to be like and if it would work for us. I think maybe I'd like the board to give the direction to administration to do some research into the mask area.
And I appreciate that, and I think that when we do this, we need to do it right. So if we're going to get, you're going to get the mask that would actually protect people, and guess which, please come and approach the bench. Yes. So.
Madam Chair and Commissioners, we can't even fulfill PPE and masks for our first responders and law enforcement, so I don't know how we would even come close to getting what would be required to hand out to the public at our building.
And Madam Chair, if I might.
Yes, Commissioner Burrell.
The thing what I'm talking about, it does not need to be an N95. We don't even want that, because those are in demand yet for the medical field and the first responders. I'm talking about a more inexpensive mask that would protect somebody from giving the virus to somebody else, and to a smaller degree prevent it from coming back. And for people to say that it does not work, go back in history. You can look at what happened with the Spanish flu back in the 1918-19. Philadelphia did nothing. They had a parade even, spread the virus all around. Just thousands and thousands of people were dropping dead. And where another city, San Francisco, required everyone wear masks, and they were hardly touched by the first round. They did get some more later when they kind of dropped their guard and stopped wearing the mask. But it does work. History has shown it works, and it's working in all these other countries that over Indonesia, Taiwan, South Korea, Japan. These countries that don't have the phobia of wearing a mask or the stigma. It's working, and it's dropping their cases down, and that's where I think we need to at least look into.
Thank you, and Seth?
Burrell, if I
Yes.
may, and I'm not arguing any of that fact with you, but even the cheap masks, the surgical masks and so forth, those are in major demand, and like we're struggling to get them for the long-term care facilities, for congregate care facilities. That's why that cloth drive, face mask drive went out for the fire departments to collect to give to those people. So I don't know that you could get the quantity you would need to get to the public. That's all I'm saying.
Yeah, and there has been, the sewing campaign, and I was actually part of that with Buffalo Rotary, made 2,500 masks. Now we're buying the filters, so the people, they're washable, but you need to change the filters in them. So that's kind of step 2 of that campaign, but it's the one that North Memorial, the pattern that North Memorial has online, and they have a tutorial, so you can actually, sew these masks, and it has a pocket in there for the filters, and that's been a pretty good. It's been a really good pattern. It's some of us that are, haven't sewn for a while. It took me a little longer to sew than probably most people, but there's a lot of people that are out there. And they do have masks on. You go to some place like Menards or a grocery store, and a lot of people are wearing the homemade masks. So not everyone is, but a lot of them are.
And I want to be careful in the terminology too. I mean, there's mask and there's face covering. I think anything we can do to
That's true.
cover the face is of benefit. Certainly mask, I guess in my brain, is more of a connotation of the N95
Right.
that's been discussed. So, but certainly we can look at different opportunities to provide something along the lines of what Commissioner Burrell's discussed.
Madam Chair?
Commissioner Burrell.
Yeah, and I don't know, is that Seth that's being the naysayer there, or who is that?
Yeah, Seth, I'm sorry. I should have.
Okay.
I should have.
Seth,
but-
okay.
Commissioner Burrell, I'm not a naysayer. I'm just saying I'm afraid that you might not be able to get what you're looking for. That's all.
No, but listen to what I said. I never said order them up or whatever. I said I want administration to look into it, to check out the feasibility of it, and to see what the costs would be, what they would look like, and even order, if they can get a sample, find out what the quantities that they can get, and what the timeline would be. I just want some research done on this. Now, we don't want to wait 2 more weeks and then order them, because then it might be a huge demand for even the cheap ones.
Yeah, and yeah, we appreciate that, and administration is looking into that, so we can have some better answers as we get some research done on it. But you're right, Administrator Kelly's right. They're probably more face coverings. You can make one out of a bandana, and put hair bands around it, and that is so many layers of thickness that it really, if someone would sneeze or cough, it does keep it in there. I mean, I'm not a health expert, so I'm not going to say that it's completely foolproof, but certainly any face covering is definitely a help for people.
I guess at this time, we have a couple of weeks, because we're not, as it looks right now, imminently, we're not opening this building, so I guess it's kind of more of a further discussion piece, and we haven't really developed in its entirety phase 2 of what that's going to look like yet, so that's kind of some more of a discussion point that we'll have between now and the 18th of May.
Right.
So I guess getting the information, as Commissioner Burrell asked, I guess getting some numbers can't hurt. But then we do have to understand that there is a real supply demand issue. So.
Right, and certainly we can get it out to the public that if you're coming in to the government center or one of our buildings, please wear a face covering for the immediate future, so,
Madam Chair,
yes.
um,
Oh, Mark.
I just forwarded to you, the Wellness Committee are looking at something for the employees, and they're fairly inexpensive. They are just a face covering, and those will have the county logo on them. So there will be some, and I don't know how long it's going to take to get them in, but it sounds like it wasn't going to be too big of an issue.
Okay,
I think they have to order 1,000 of them.
okay.
So there should be some available to experiment with and look at and figure out what will work.
Yeah, and that's certainly, that's enough to cover our 750 employees, plus some extra.
Madam Chair.
One day,
What?
for one day.
They're only used one day?
They're cloth.
Use them?
They're
Yeah.
cloth. It's
can wash 'em.
It's essentially, it looks like it's like a scarf almost, like a neck warmer, but of a
Madam
softer
Chair.
fabric.
Commissioner Burrell?
Yeah, Madam Chair, I looked at the one that the Wellness Committee, I would recommend ordering just a few of them if they were to do that without even the logo on it, and see if that's really, because it looks like you're all going to be bank robbers with those things there. I did not really care for the look.
Well,
Well,
I did see that, in the old days, that if you had somebody walk into a bank with a mask on, that was serious. Now you want them to walk into the bank with a mask on, so, things have changed drastically.
yeah, it's the second one on that sheet that they're looking at.
I do like how
Think
the
about
guy has
87 cents
sunglasses
each.
on in the picture, so he's wearing a mask and dark sunglasses. So.
Yeah, no, the first one doesn't. That's not a good one.
So, yeah. Well, yeah, definitely, we will, administration is looking into this, the Wellness Committee is looking into this, so we'll get some better answers going forward. But the larger quantity you order, the more affordable they are.
Madam Chair.
Madam Chair,
Go ahead.
Yes,
I'm assuming that we'll have COVID-19 on for the board meeting next week. Also,
yes, thank you. We will have that on the agenda, as we have been.
Madam Chair, Administrator Kelly, are you looking for us to formally adopt Phase 1 implementation here today?
It'd be great if you could. I'd like to put this out both to the public. I've communicated that this was the draft of it to department heads already, but I'd like to get that out to all staff so they're aware of the
Okay.
plan.
So, Madam Chair, I'll make a motion to approve the Phase 1 of, I guess what do we call it, workplace
Well,
I want to caution, I've kind of used the reopening as the term, but to manage expectations, I'm anticipating this may be a longer process with multiple phases.
right,
So,
Right,
but
so-
I've been generally using reopening, I guess.
right. Phase 1 of
Phase 1
reopening.
of, you have a bit of reopening business and workplace protocols.
All right.
I'll second it.
Motion made by Commissioner Vetch, seconded by Commissioner Delyden. Is there any more discussion on this? Hearing none, roll call vote.
Aye.
Aye. Charlie?
Aye.
Mark?
Aye.
All right. Motion passes 4-0. And we did have, this is kind of related to COVID also, but we had some discussion about some funding.
Yep.
And Commissioner Vetch?
Okay, so, Madam Chair, I'm requesting that I'd like to schedule a committee of the whole for Monday, this coming Monday at 1 o'clock, to discuss, our funding allocations and the funding through the Central Minnesota Council on Aging and how that relates to Wright County Community Action and some of our senior meals that we are, struggling to get funding through that, so it kind of comes to a greater discussion on where the revenues come in from the state to the Council on Aging and how those are allocated out throughout the variety of counties. So kind of want to know look, I requested that they would bring the information that how the funding from the state is derived from the state to them, how the money comes into the the Council on Aging, and then how they then take that same money and how is the funding mechanism sent out, dispersed. So,
Yep. Yep, well, thank you. Thank you for reaching out and gathering some information and get some initial information. And,
Madam Chair?
yes, Commissioner Delyden.
You know, as long as we're looking at just different funding, I know health or public health got some additional funding, which may help us pay down some employees and that sort of stuff. And then I also believe that the state was getting some funding too. So I'd be curious to find out how that's going to be distributed to the counties. The states were all issued some additional funding, and I don't know if we've gotten any, if we have any idea how that's going to be distributed. I mean, that's something else that we should look into also, I believe, as long as you're looking at additional funding amounts.
Right, and I mean, there's different funding for different projects and that kind of thing. And this was more specifically to, with the senior meals and you know, the money for Wright County Community Action to get the meals to our seniors and to help with that. And so I think that it's a more specific request at this time with Central Minnesota Council on Aging.
because they're as you probably already know, Commissioner Dahlett and Commissioner Burrell, that Wright County Community Action is at $0 to facilitate the meals that they currently are asked to deliver. So they're in a kind of a quandary as to where to go from where they're at right now. They are kind of taking leaps of faith, and they are scrunching together what other funds they can to facilitate it on a day-by-day basis. So we're trying to have a greater discussion on how we can make this happen. So this is kind of the first step of maybe other discussions that we may have to have in regards to this issue.
Madam Chair?
Commissioner Burrell?
I'm just wondering, I'd like to ask Commissioner Vetch, has he got it arranged with Central Minnesota Council on Aging to be in attendance already?
They are. Lori Volson will be there on Monday.
So,
Okay, and then are we okay on the, do we have to have a notice on that, or it's a committee meeting, so?
we would have a
I don't
notice,
know.
and that's why we're discussing it now. So we've got the more than 3-day notice to call a committee of the whole for Monday afternoon.
Okay, perfect.
So,
With that, I'll make a
Is there-
motion to set that committee of the whole for Monday at 1 o'clock, to set a committee of the whole to discuss Central Minnesota Council on Aging, revenues, expenses, and to discuss the food program at Wright County Community Action. I would like to send an invite out to Jay Weatherford at Wright County Community Action as well to participate in this hearing as well.
all right, so we have a motion to set a committee of the whole with the Minnesota Council on Aging at Monday, May 4th at 1 p.m. Is there a second?
Madam Chair,
I'll second it.
All right. Motion, seconded by Commissioner Delyden. Any more discussion? Hearing none, roll call vote.
Aye.
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 All right. Motion passes 4-0, so we'll get that on the calendar and
We will get that
Quick
posted and communicated out. Just responding quickly to Commissioner Delyden's question, a lot of us are interested in the funding of what's going to come. I know there's discussion at the legislature. There was a first round of funding that went out to the larger counties above 500,000. So there's discussion now of how that's going to be distributed to the remaining counties, is my understanding. There's been different ideas floated as far as how that would happen, if it's a flat rate, population-based, or combination thereof. So hopefully by maybe Monday, not sure, but I'll provide you updates as we get them, but
appreciate
we're waiting as well.
Madam Chair, Seth, are you going to be able to participate on Monday at 1 o'clock or?
Okay.
Awesome, great.
Sarah, did you have any updates or anything that you would like to, our Director, Public Health Director, Sarah Groschus?
I can address the funding piece because we had a fiscal meeting this morning as well. We were granted $147,000. You signed that rather quickly. That was in our COVID response funds. It was specifically for public health response. That money is already been spent. It's gone. So we had a discussion of how we were going to code and collect our time going forward. Commissioner Vetch, I believe you were at the EMAC FEP meeting when this was before everything really popped, and we heard that we might get $400,000. Yeah, so that didn't happen. And I know that Julie Ring from AMC, as well as folks from local Public Health Association, our executive director, are trying to get an accounting from MDH because none of the additional funds that have come back through FEP have been allocated to the locals either. We got our regular public health emergency preparedness grant renewal come through, and that came through with $1,800 more, which didn't even account for the cut that they gave us of about $3,600 last year. So that is flat funded, and that really just pays for Hannah. It's not a response fund. That's like business as usual grant money. So that was disappointing. From a response, we have staff being trained by MDH. We'll be taking on all our case investigations beginning probably early next week. You know, I think I would recommend, I know that you would love to hear from me where all the cases are coming from and all of that stuff, but there's lots of situational awareness you can gain from the app. So we're certainly paying attention to what's happening in the counties surrounding us, and as testing rolls out and there's targeted testing for some at-risk groups, we're seeing definitely some increases around us and even internally. So that's just something to be aware of. So we worked with HR today on a staffing plan, and we'll be rolling that out to staff.
Yeah, a lot on your plate.
So the long term, we also would like it's important for us to see long term the economy come back. That's good for the health of our folks. So, but that means a lot of heavy lift for us because it'll be all on isolation and quarantine to keep the stuff under control. The last thing we want, I think, is an opening and closing and opening. That's just not system.
Right, and I appreciate that, you know, the kind of graduating, so, yeah. Graduating,
Any
opening.
questions?
No, I wish we had better access to a lot of funds. I think right now there's a big mix as to the money that came from the feds down to the state, and then how that money's getting divvied out or not getting divvied out is kind of really where a lot of the big question marks and the
Right,
struggle
for
is with
sure.
a lot of this. So it's tied up in a variety of different agencies or just at the state level trying to figure out what department within the
go.
state should be allocating it out.
Yeah, so,
Okay.
all right, thank you. All right, anyone else have anything to bring before the county board today? If not, we are adjourned at 10:31. Thank you.
Great.